Hello, Jan Wekemans for the hashtag One Patient, One Record for Belgium. Today I'm here together with Vincent. Vincent, can you present yourself, please?
Yes, nice to meet you. And I'm Vincent. Yes, I'm the founder and CEO of Andaman7. What is that? Actually, it's an initiative with a social project. So we want to give patients the control of the health data, and we want to help them store everything on their smartphone. So we try not to store any data in the cloud, so for privacy reasons and for security reasons. I realized when I had cancer like almost 15 years ago, and my son also has had a cancer. He was 10 years old, so pretty young. So we had a double family experience with cancer, and we could see how important it is for patients to have access to their data. So this is why I created that social part of the project, which allows patients to be empowered with their data. And since it's social, I want it to be free to patients. So that means that we need to find revenues in other areas or other players. And currently, the main revenue comes from the research industry, so the pharma companies and biotechs and medical device manufacturers, which run clinical trials with those patients. But of course, every time there is any kind of exchange, the patients must consent. Usually the doctors invite the patients to the trials, so there's also the medical world that is involved there. And so voila, it's a combination of a social project free for patients with a mobile app where you can store all of your health data, and a revenue part that also contributes to the benefits of patients, because if you can do medical research faster and cheaper, it benefits the patients because there are more treatments and faster treatments.
Voilà. That is very clear. Actually, that is also very hashtag-like, because we say one patient, one record for Belgium. What you say is one patient, one record for your mobile phone.
Yes, exactly. Yeah.
But that's an intriguing choice. Why the mobile phone?
Well, I think that the mobile phones are the computing platform of the future, right? First, they are extremely powerful, right? And some of them have capabilities that your computer do not have. Yeah. So they're already a bit more advanced. Also, you have them with you all the time. When you go to the doctor, to the pharmacist, to the hospital, you don't have your computer with you, right? But you have your phone with you all the time. Yeah. And if you store everything on the smartphone, not only is it good for privacy, for security, but also you can use it if you don't have internet connection, which happens even in industrialized countries like ours. You don't have access to the internet in hospitals sometimes.
It frustrates me from time to time.
Right, exactly. So having all of that on the smartphone, I think, is important. And now you can control a smartphone with your voice, right? Dictation, but also commands. So everything goes in the directions of smartphones. So they are almost an extension to your brain, right? I think.
The question that I'm left with, and that's basically, I'm already one for what you say. The only question I have is, how does a doctor consult it? Or how does anybody else consult it?
Yeah, so, okay. Our goal is not to have the central repository or a unique repository, right?
Okay. So it's a copy or?
Yes, it's always a copy of the data locally on a smartphone, but the data usually also resides in a hospital or at a family doctor's practice or in other areas, right? So we collect a copy of that and we store it locally, and then we can share it with doctors. And it will go probably to their systems, right? So we are not really focused on having one central, somewhere in the cloud file where people have access or not. We have a copy of the data within the patient's control, and then they can share it with somebody else, which means sending a copy of some of the data. It's closer to emailing, than to have a central server that is accessed.
Okay.
Right?
Yeah.
And we believe that we are probably the first completely distributed health record because
you're the only one I've ever heard of. So yes, in that respect, if there are any others out there, we'd like to hear about them,
Yeah.
because it makes life easier if you're not alone, because you're now a forefighter, you're a
Yeah.
the evangelist of the system, to put it that way.
yeah.
Are there any hospitals you're actually already working with? Is there any liberty to talk about that?
Yes, sure, there is. So in Belgium, unfortunately, the market is not open, according to me. You know, we have 4 regional networks that do good work, right? They improve the situation. I recognize that, and it must be difficult to do sometimes, right? But it's still very much controlled by the hospitals,
Yes.
right? And the openness to patients is limited. Is, according to me, really too much limited, right? So we try, for example, we try to work with those networks, and none of them has accepted, as of today, to open to the patients using Andaman. And I can swear that I have hundreds of requests from patients saying, when will my hospital send my data to in Andaman, or when will the regional network open up? And I keep telling them, ask them. And they do ask, and they send hundreds of requests, no openness. So if I may, I would like to put in front a specific hospital, which is CHU de Liège, because they have done the work of connecting directly to Andaman7. So that means there are thousands of patients that receive automatically all of their information without doing anything, right? You first have to authenticate once to make sure everything, but the rest is all full automatic. Now, outside Belgium, in the US, a small company like us is already compatible with more than 10,000 hospitals. So that means that approximately 85% of American people can download Andaman7 free, connect to the hospital, and get a full copy of their health data locally. Okay. So that's what I hope other countries will do, not only Belgium, but everywhere in Europe, hopefully.
Well, that brings us much closer together, because we actually are advocating the same kind of thing.
Yeah.
Because if you look at what we are saying, is we want actually the actual data of the patient available, not just for the patient, but for anybody who has a benefit in using that data to the bettering of the patient.
Okay, yeah.
For me, you know, clinical studies are for the bettering of the patient, but I think it needs to happen with the consent of the patient.
Of course.
It doesn't even need to happen with the consent of the hospital. It's the patient who needs to do it. And so we don't want necessarily one record. We want one access, so that all the data is, if we look at GDPR, for instance, as well, GDPR says that you as a patient are entitled to have a view on all the data that's available of you. I challenge everybody to find that data. Some of the data is so difficult to find.
That's
because
true.
we are not open with it. You know,
Yeah.
we're champions in gathering information, but it's like hoarders, you know, the people that you see on the television programs where they have a house that is packed full with material. Well, we're packed full with data, but then comes the problem. Go and find it.
Yeah.
And on our smartphone and on our computers, we go to Google or to whatever and go like, find me this, and it magically something comes out.
2 seconds, yeah, it's crazy. Yeah.
If you do that in a data lake with millions and millions of even billions of records, I just recently heard of a company that had 7 petabytes of data. I can't even imagine how big that number is.
Yeah.
Let alone that I would find what I was looking for.
Yeah.
So
yeah, that's a.
Now, my question to you is, you have done this. You have actually, in one of the biggest markets of the world, you have success. What's the future?
How was the future?
Or where do we go from here?
Yeah, so, well, one of the first goals is to scale, have more users and in more countries. Currently, we are already available in all countries, in theory, via the App Store and so on. We do support more than 20 languages, right? So that's English, Spanish, most European languages, but also Chinese, Japanese, Arabic, Russian, Hindi. So all of these difficult languages for us, I mean, because it's sometimes right to left and so on. So we support all of that so we could have a global approach. Now in practice, it's still difficult to reach these countries, but we're ready to do that. What I hope also is that the work that we do currently with research, right? And research is half of the solution, right? The solution is care. Doctors, nurses, and so on. And they need to work together. And today, I think they are still too much separated, right? So my dream also is to bridge these two. So currently, for example, with our system, we can connect to hospital EHRs with their format, with their standards, with their schema, database schema, and get the data. And then we can send that to the research industry, which use different tools, EDC, CTMS, right? Other formats too. They don't have the same format as
it's not HL7 or
exactly, but it's the same data. Yeah. It's about your health, right? It's about your allergies, the drugs you're taking. So it's crazy. How could the world be so separated? So our storage format, and you were mentioning the difficulty of accessing the data, which is absolutely a huge problem. Interoperability is one, but how to nicely represent the information, which is so diverse, right? And keep it evolving because the needs evolve, right? COVID is a good example, but you don't need such a pandemic.
Please, no more.
Yes, right. But the needs are evolving clearly. Yeah. So the standards must be very evolving. And so there, I think that humbly, we have found a solution which is extremely well suited to the market. But that's really information management level, and it's a bit more technical. That's
behind the curtains, you know.
Yes.
The customer wants to see the front end, they wants to see what happens. That's where we are equal. We need to we need to make sure that the magic happens without it being shown.
Yeah,
that's true. Like the magician does as well. Whoop, and there is the flower.
That's true.
I can see.
Yeah.
One last question: if you would have a choice on how to go forward, what would you do, change, want to happen?
Well, it's not different from the dreams I have currently, right? Which is to give all patients of the world the possibility to manage their health data, to have more freedom of choice, choosing doctors, second advice, moving from one country to another, or any kind of reason. So if you have your data about your health, that's super important, right? So I would like that to be scaled to as many people as possible, and that this platform with a large amount of patients on it, if the trust is there, if the respect of patients is there, of privacy or control also, not only privacy and security and all of that, then the flow of data can be much better and serve the needs of both the research players and the care players. And that could really speed up many things in the healthcare environment, which is still very slow, I think, compared to other sectors, right? For good reasons sometimes.
Slow because they want to be careful, but I think sometimes they're just slow because it's how they are used to go.
Yeah, and it's a complex world, right? The data is complex, and there's privacy issues, security issues, so you cannot go without those. So it's always a bit more complex than other fields, but it's still too slow.
But that gives us a common goal, so I hope we can continue along this line. The hashtag One Patient, One Record for Belgium might soon, or might take a little bit longer, but we'll get to One Patient, One Record for all. And with that, Vincent, thank you.
You're welcome. Thank you for having me here. Thank you.